Welcome to my presentation, Navigating Inclusion and Health Disparities, Supporting Individuals with High Support Needs in the Community. This is a closer look at individuals with intellectual and developmental disabilities, IDD, who have high support needs, including the barriers they face within their communities and the health disparities they often experience due to their disabilities. This presentation will also highlight the perspectives of direct support professionals, DSPs, and caregivers who provide critical support and navigate these challenges alongside them. Why I chose to highlight this topic. I wanted to make an impact in bringing awareness of the difficulties caregivers and direct support professionals face in supporting their clients in the communities. I wanted to impress the need for proper support. Individuals with intellectual disabilities are often placed into community settings without sufficient support, often leading to isolation for both them and their caregivers. There is a stereotype. Discrimination and stigma can often further exclude individuals with IDD from the community. They are often seen as unable to learn, make decisions, or contribute, and may unfairly be labeled as burdensome or aggressive. Despite laws protecting the rights of individuals with IDD to live in the community and access services, challenges persist. Many face long wait lists, a shortage of direct support workers, and healthcare disparities due to cultural and systematic barriers. Individuals with IDD are often face exclusion from important healthcare decisions and limited opportunities for meaningful community participation due to harmful stereotypes and biases. Stereotypes in healthcare can exclude individuals from making healthcare decisions. Many presume individuals with IDD cannot make informed decisions, leading to the exclusion of critical treatment discussions. Sometimes this means DNR orders will be placed without consent, undermining autonomy and preventing active involvement in their decision-making. Consequences of not involving individuals in their own health care can result in poorer health outcomes and lower self-worth, hindering successful inclusion in the society. So let's look into stereotypes in the community. There is a belief that people with IDD cannot contribute meaningfully to work or volunteering, limiting their participation in society and excluding them from important community roles. These assumptions foster isolation, reinforce the idea that individuals with IDD are less valuable, and create a cycle of dependence and disempowerment. Individuals with IDD are also often treated as incapable of making decisions or handling responsibilities, hindering their own personal growth, independence, and participation in the community. Here are a few evidence-based practices addressing biases and stereotypical attitudes. PCP, person-centered planning. This idea empowers individuals with IDD by positioning them as expert in their own lives, focusing on strengths and interests to promote community integration. Some challenges of this, though, are the shortage of trained facilitators, limited services, time constraints, and reluctance from non-paid staff to participate. Training for healthcare professionals is also available, a proposed training program for healthcare providers to improve their knowledge, skills, and attitudes towards working with people that have IDD, aiming to improve health outcomes. And a systemic change for equity. Policy initiatives focus on improving healthcare provider training and support to reduce health disparities and promote equitable care for individuals with IDD. There is a lack of accessible communication methods which can prevent individuals with IDD from expressing basic needs. This includes ordering food, requesting restroom breaks, or making decisions about where to go and for how long. Many individuals with IDD can benefit from visual supports, as often they are visual learners, while others rely on augmentative and alternative communication, such as an AAC device, to express their needs and preferences. Service providers and the public may lack training in communicating effectively with individuals with IDD, leading to misunderstandings, exclusion, or even a denial of services. Additionally, individuals may be presumed incapable of making decisions, causing conversations to be directed towards the staff instead of the individual. Individuals with IDD are also often excluded from the policy-making procedures, leading to decisions that affect their lives without considering their input or their lived experiences. Variations in state guardianship laws result in unequal treatment and opportunities for individuals with IDD, leading to disparities in access and care. Even with inclusive policies in place, underfunding leads to limited access to critical supports like personal assistance, job coaches, accessible transportation, and inclusive housing, preventing full participation in the community. The number of individuals on a wait list for home and community based services has increased by 3.3% in 2023, impacting nearly 497,000 people. Rigid eligibility requirements for Medicaid and Social Security exclude individuals whose functional needs and goals don't meet specific criteria, often limiting access to necessary support. Systemic challenges like inadequate Medicaid funding, institutional bias, workforce shortages, and the growing crisis of unmet needs continue to undermine the access to long-term services and supports. There are some evidence-based practices for equal access. Colorado State University offers an online course called Skillfully Working with People with Developmental Disabilities. And this is a part of a growing trend among universities offering similar courses in fields such as special education, social work, human development, psychology, and public health. The NICIP also provides a framework for integrating disability, inclusive, evidence-based practices into community settings. It focuses on addressing systemic barriers and promoting greater accessibility and participation for individuals with IDD. So in my topic research, I did interview a direct support professional and just wanted to find out some of the challenges that he's facing with taking his clients out into the community. So we'll review those questions. I asked, what challenges do you experience when supporting your client in community outings? He said he comes across issues like the client being hungry but not being able to relay that to them, interactions with other people, loud noises, and crowded areas. He also has difficulty finding suitable environments for specific client behaviors. I asked when out in the public if he's noticed any specific attitudes that create discomfort or barriers for clients in the community. He says he has received uncomfortable reactions from neighbors, such as fear or confusion when they're walking by. People without experience with IDD tend to be more uncomfortable and just avoid interactions. I asked how staff at places like stores and restaurants typically respond to his clients, and if they're helpful or if he feels he faces misunderstanding. And he says the cashiers tend to be understanding, especially if they have family members with special needs. Some people avoid interactions due to unfamiliarity with individuals with IDD, but he says generally he does have positive reactions in hospitals and doctors' office who are often used to seeing that population. I asked if there's any community or policy rules that have made it harder for him to support his clients. And he's limited with the company he works for on where they can visit with their clients. There's also a lot of financial limitations, and there's approval requirements that need to be made for certain outings. I asked to share an example when the lack of accessibility or accommodations made a community outing difficult. And he stated he did have a client in a wheelchair after the client had had a recent procedure and they went to a place that did not have a ramp. The staff that he was with was unable to lift the wheelchair, and they weren't comfortable lifting this client out of the chair, so they were not able to access the place. And asked him what supports or trainings in for him or the public would make community inclusion easier for people with IDD. He noted training on resolving behaviors in public to prevent harm and precautions and strategies for handling different situations to avoid meltdowns with the clients. Transportation was another issue, and we talked about how that impacts the ability to plan inclusive outings with the clients. He shared that the transportation leads to availability issues and miscommunication as they share a van between houses. Often they've noticed there's double booking or an availability, and that would affect the outing plans that they had. I asked if he could improve one thing about how community spaces welcome and include people with IDD. And he mentioned that designated times for businesses to welcome these clients would be helpful in reducing stress for the clients and the staff. For example, they did a putt putt golf outing with one of the clients, and he said if he knew for 2 hours that he could enjoy it at their own pace and not have to worry about other individuals coming up and being frustrated with the amount of time that they were taking. Just if they knew that up front, that it was a specific time frame for his clients, that would make the outing a lot more relaxing. And they'd more likely do it again. A few other questions that I'm considered after completing this assignment was how individuals with IDD themselves would describe their experiences in community settings. And I'd want to compare that to how staff or caregivers describe them. Another one is how can organizations be better balance safety concerns with promoting autonomy and choice during community activities? And what strategies could we use to reduce the stigma and fear the public sometimes feels towards individuals with IDD? And I'm wondering if anybody out there has any other questions about the topic that they would want to add. Thank you for listening to my presentation. I hope it was insightful, and I appreciate you taking the time